Doctor, hello. I understand you've been experiencing some allergic reactions, and I'd like to explain the different types of hypersensitivity and how we can manage them effectively. There are actually four main types, each with different causes and treatments. Are you familiar with any of these types? Patient, not really, no. I just know I get reactions, but I'm not sure why or how serious they are. Doctor, that's understandable. Hypersensitivity reactions are essentially overreactions by the immune system to substances that are usually harmless. Let's go through the types briefly, and I'll explain which treatments are most suitable for each. Type 1 hypersensitivity, allergic or immediate hypersensitivity. Doctor, type 1 is what most people think of with allergies. It's an immediate reaction, usually within minutes, to things like pollen, certain foods, or insect stings. The symptoms can range from mild, like itching and sneezing, to severe reactions like anaphylaxis, which can be life-threatening. Treatment. For mild reactions, we typically use antihistamines or decongestants. For severe reactions, an epinephrine injector, such as an EpiPen, is essential to keep on hand in case of emergency. Avoiding known allergens is also very important. Type 2 hypersensitivity, cytotoxic hypersensitivity. Doctor. Type 2 reactions involve the immune system attacking cells in your own body, sometimes triggered by medications or blood transfusions. This type can lead to issues like hemolytic anemia, where the immune system destroys red blood cells. Treatment. The key here is to identify and remove the triggering substance, often a specific medication. In some cases, we might use corticosteroids or immunosuppressants to reduce the immune response. Type 3 hypersensitivity, immune complex hypersensitivity. Doctor. In type 3 hypersensitivity, immune complexes form in the blood and settle in tissues, which can lead to inflammation and tissue damage. This type is seen in conditions like rheumatoid arthritis or lupus. Treatment. Managing this type often involves anti-inflammatory drugs, corticosteroids, and sometimes immune-suppressing medications to control the immune system's activity and reduce symptoms. Type 4 hypersensitivity, delayed type hypersensitivity. Doctor. Type 4 is a delayed reaction, usually taking 48 to 72 hours to develop. This is commonly seen in conditions like contact dermatitis, where you might react to metals, fragrances, or latex. Tuberculosis skin testing also works through this delayed type of response. Treatment. For skin reactions, topical steroids and avoiding the offending material are key. For other forms, we might use different anti-inflammatory medications. Patient. That's really helpful. I think my symptoms match type 1 because they happen right after I eat certain foods. Doctor. It does sound like that could be type 1. I'd recommend we start with an allergy test to confirm your triggers. Based on that, we can discuss the best ways to avoid those triggers and, if needed, prescribe medications or an epinephrine injector. Patient. Thank you, doctor. I feel much clearer on what's going on and what to do about it. Doctor, you're very welcome. I'll make sure you have the right resources and support for managing this.